What's up, YouTube? Welcome back to my channel, and in this video we are doing a remote nurse vlog. So tonight I'll be working a 12-hour shift as an acute care virtual nurse on nights. So my schedule tonight is from 7 p.m. to 7 a.m. So right now I'm just getting dinner ready so I don't have to rush back and forth between cooking and working. I'd rather just have it all done. So me and my daughter are making dinner tonight. Also, in this vlog, we'll be getting into why I ended up leaving the bedside to do remote work, what it is that I do as a nurse working remotely, what it's like being a mom and basically being a stay-at-home mom and working as a virtual nurse, things like that. So I guess I'll just get into exactly what it is I'm doing working remotely as a nurse. So I'm doing what is called acute care virtual nursing. I don't care what anybody says, it is a newer specialty in nursing. We weren't doing this before, so I'm going to tell you what is happening now. So basically they're bringing nurses to the bedside through electronic means, to help support the nurses and the patients on the units, doing things like admissions and discharges, rounds, medication sign-offs, skin checks, all that stuff. Okay, all that stuff now can be done by a virtual nurse. And like I said, they're bringing this nurse to the bedside through electronic means. So that means patients either have cameras in their rooms on top of their TVs, or they're using some type of iPad or something like that. Either way, it allows nurses to work from home and still be a part of bedside care, which I think is so needed right now because a lot of us are feeling that exhaustion still post-COVID. And honestly, if COVID-19 didn't happen, I don't think this opportunity would have been able to be presented for nurses. So that's exactly what I do as a nurse. And if you clicked on this video, you are interested in remote nursing to some capacity. So I'm going to go ahead and take this moment and introduce you all to today's sponsor of the video.
Nursing Connect is a remote nurse staffing agency dedicated to helping nurses find remote work as well as place nurses in roles for organizations who offer remote nursing. The roles we look to fill are inpatient virtual nurses, case managers, and psychiatric nurse practitioners. If you have experience in any of these areas, please submit a resume for general consideration. Not only does Nursing Connect fill remote nursing positions, they also offer virtual nurse training. Acute care virtual nursing training is now available. This is a growing specialty and a newer specialty in nursing. So they offer training. To get additional 10% off of the training, you can download the Virtual Nurse Overview, which is highly recommended. This Virtual Nurse Overview gives you more insight about the role to make sure it's something you want to pursue before taking the course. Everything will be linked in the description below. All right, now let's head back over to the video.
All right, y'all. So we already talked about what I do as a nurse. Now let's talk about the stay-at-home mom aspect portion. So because I work 12-hour shifts, it allows me to work from home 3 days a week. So most of the time my child is with me, and if I cannot, or if I'm having a shift where it's just not possible for her to be with me, then my sister's also a stay-at-home mom and she'll come over and just watch her for me, which is great. So that's how I kind of handle that. As far as like people always ask, can you work with your kids while you're at home? I can only speak for, I only have one child. She is 3 years old and she's pretty independent, self-sufficient, as far as like telling me what she needs. She knows when I'm working, so she knows how to, kind of stay quiet when I'm talking to her on the phone. So that's what it's been like since she was about 8 months. I've been working from home since she was about 8 months old. So that's how I kind of do that. And then the next thing I want to talk to you all about is why I left bedside nursing to do this. So I left bedside nursing for the same reason a lot of us do. It's just not sustainable role for someone to work 10, 15 years. The workload is heavy. The patients are getting sicker. So trying to maintain that acuity, and yeah, overall it was just not a sustainable choice for me, especially as a mom. So I decided to switch. All right, YouTube, so I am at my desk, get ready to start my shift as a virtual nurse. And I just wanted to take y'all along with me on what I do to get ready to start my shift as a virtual nurse, as a mom, doing all the mom things, and then getting ready for work. For the most part, getting ready for work does not take me long at all. I got my scrub top on and a headband to match, and my hair pretty much stayed done, cause yeah. And then I got my blue light glasses off the TikTok shop. Which I think, is it giving or no? Is it giving what's supposed to give? It's a little bit thicker than I would like the frame itself. I don't like that chunky look. I like kind of like a lighter, slim look. So I don't know if I'm a fan of those, but so I've already kind of looked at my assignment, see who I'm working with. So as a virtual nurse, you can get assigned a unit of patients or a whole hospital system. And tonight I got assigned a unit of patients. So I'll be on the trauma floor, and that is about 30 beds. So I'll be responsible for supporting all those patients with admissions, discharges if needed. It is a trauma floor, so I'll be doing a lot of pre-ops because a lot of patients are going to surgery in the morning, and I need to go in there and do those assessments, make sure they're ready for surgery and things like that. And then the people that we have on tonight working virtual nurses, I got a great group of people on. And I say that because sometimes you'll come to work as a virtual nurse and some of your coworkers will watch you work all night and not do too much. And you're doing like all the tests or all the admissions, all that all night. And you like, hey, what's your name? Did you go to sleep? Like, are you up? But I don't have to worry about with this group of people. We gonna get it done. And then what else do I do when I start my shift? That's really it. And then I go ahead and log into the EMR. I'm using Epic. And then I get ready to start seeing my patients. So usually I come up on the TV screen in their hospital room. So that's how they see me, and that's how I see them. It's like a FaceTime call. That's what I tell them. It's like a FaceTime call in the hospital. They're like, oh my God, this is so weird. And I'm like, I know, it's a little different. I'll be like, there's no recording, there's no filming, because HIPAA, you can't do that. And when I leave the room, nobody's still watching you. It turns off. And that's what I like about virtual nursing. And I think that's one of the misconceptions people think about virtual nursing, is that you sit in and watching the patients. They do have services for that, but that's called virtual sitting. Okay, that's usually like a aide or a tech that sits and watches the patients. It's not usually a nurse for the most part, but with virtual nursing, you're in and out of the patient's room. You're not continuously monitoring them, because I'm not about to sit for 12 hours and just watch somebody. I didn't go to nursing school just to watch you all day. I'm sorry, I did not. that is so boring. But yeah, you pop in the room, you do your tasks with the patient, like you do your MRI checklist or your pre-op with them, and then you leave, and then you move on to the next patient. And you're doing that like pretty much the whole shift, just, you know, popping in with patients and families, and you know, but they're getting used to virtual nursing though. I can tell, like some of them are like, oh yeah, I came here a few months ago and y'all did the virtual thing. It's pretty cool. Yeah. But that's why I make these videos and I create this content, because I'm showing y'all what's possible in nursing and what's happening in nursing right now. Okay, this is one of the ways they are looking to combat the nursing shortage, is to bring on virtual nursing. All right, and they're going to need virtual nurses. And where are they going to get them from? Right? Where are they going to get all these virtual nurses? But you're going to watch my videos. You're going to stay informed. Okay, and you're going to learn about all the opportunities that are present in virtual nursing. Okay. I think I mentioned this already, but I created a virtual nurse overview. It'll be linked in the description, so you can learn more about virtual nursing, kind of the specialty itself, the practice, what virtual nurses actually do, pay, where virtual nurses practice. Right now, for the most part, I've been practicing a lot of like medical surgical units, and they've been implementing virtual nursing on a lot of these high turnover units, med surg, ICU, but I've mainly been doing med surg and like tonight on trauma. But yeah, so if you're interested in learning more about the specialty in virtual nursing, you can check out the link in the description.